invite the first speaker for the session, Ragini Agarwal ma'am.
Dr. Ritu will introduce.
Dr. Ritu will introduce madam.
I think it's proud privilege to introduce Dr. Ragini. We can write a book on her introduction for Gurgaon. She has been founder president of GOGS, her OBGYN. She had been vice president Foxy 2020, chairperson Food and Drug Committee 2012, pioneer of cosmetic gynecology in India. And I told you that we can write a book. She has just concised it in one PPT. So it's better to hear her rather than, knowing about her. Welcome, Dr. Ragini.
Thank you, Ritu. And as a president, I welcome you all again with the blessing of God and gratitude to each one. I will start this presentation. My concept. So during pregnancy, hormonal regulation replaces genetic control in many aspects of the fetal development. And disruption at this level can have consequences from organ formation, neural development, and lifelong health. And here lies your answers to your patient, why it has happened to my baby doctor. I'm coming to you all the time. Whatever you are prescribing, I am taking. And why? And we have no answer. So when we go in these things and understand that epigenetics play a very big role, and there's more than 800 EDC identified, and they lead to increasing burden of the reproductive and the developmental disorder, ubiquity of the synthetic chemicals in daily life. Epigenetics now understood as the key link between the exposure and lifelong outcomes. So we have to remember this maternal placental fetal endocrine axis, and placenta is a central endocrine organ which produces many key hormones and also act as a barrier, but it is not a complete barrier. It has a limit to absorb the EDCs. And this hormonal harmony between maternal placental fetal endocrine axis play a very big role in the organogenesis, sex differentiation, and growth and metabolic regulation. So what are the EDC? They are basically the exogenous substances or mixture that interfere with the hormone action in the body. They mimic natural hormones. They may be block receptor binding, alter hormonal metabolism, or epigenetic modulation. So basically it's like a gun which is loaded. They have to put a trigger. And what is epigenetics? It is how the environment writes the instruction on the DNA blueprint. It's not mutation, but it is totally changed the gene expression, which is very critical period of the baby's development. So what are the key mechanism? It is a DNA methylation. It is histone modification. When this methylation is not complete, it causes changes in the gene expression, and non-coding RNAs like miRNA and the INC-RNA. So this all epigenetic process which involved in the regulation of the pregnancy will lead to a major difference how that baby is going to develop today when come out of the womb, or even in the future down the line 10 years, 20 years, or the 20 years. The epigenome is the most vulnerable during the early development, making it a target disruption by the environmental factors, and changes persist through life or across generations. So this endocrine system works on the precise chemical signaling and introduce noise and distortion into these signal when the embryonic development, when cells are highly responsive, they become confused and they become anything and not a normal process what you are thinking. So they mimic natural hormones like your plastics, BPA binds to estrogen receptor, blocking receptors, your phthalate. It is present in each and every nail paint. How many of you see the nails of your patient? कि उसने nail paint लगाया है कि नहीं लगाया है? Altering hormone synthesis or metabolism, interfering with the hormone transport proteins. So these alter epigenetic regulation and they cause a persistent gene dysfunction in form of cell differentiation, organ morphogenesis, metabolic programming. And these alterations may not manifest at birth, but can lead to lifelong health consequences and predisposing the adult disease. These all EDCs are basically lipophilic. That's why they are able to cross the placenta very easily and cause a vulnerability at the early gestation. So this time of gametogenesis, we need since ages that this is the primary time when anything can possible, because the germ cells are the pluripotent, and these are lead to the germ cell epigenome remodeling, interferes with the implantation in the placentation, affect the organogenesis, sexual differentiation, and the neurodevelopment. Mainly, EDC either mimic or block the estrogenic EDCs, plastic really on the top, and causes feminization of the male fetus and the uterine changes like Mullerian abnormalities in the female fetus, and anti-androgenic EDCs are like phthalate, vinculozine, leading to male genital malformation like hypospadias and all. So the EDCs can induce epigenetic reprogramming during critical reconvalescent phases, silencing or overexpression of the key development genes. So it is beyond one generation. That is legacy of the EDC exposure rippled through generation, multi-generational effect from mother to fetus to the fetus germ cell and go on the whole genes. Many times I don't have seen diabetes in my grandparents, but my mother is diabetic and now I am developing. So maybe it comes from the womb and that lady is now representing as a GDM in your clinic. So these are the common EDCs. BPA, DS is not but dioxins, PCBs and altrozin, and they can all lead to thyroid dysfunction, to the cognitive delay, neurotoxicity, immune dysfunction. So it is a real world relevance which we have to understand. Now, what they do in the genital differentiation, cryptorchidism. It was always we think why it is happening to some fetus. Mullerian abnormalities, and it is a critical window of the hormone-dependent organogenesis. So basically what happened when in the real environment there's an exposure and this have an effect, maybe a mixture type, maybe binary mixture, tertiary mixture, or all of them leading to the organ level problem like Sertoli cell function, spermatogenesis, estrogenesis, decreased semen quality to the individual level like in female alterogenesis, follicular atresia, decreased oocyte quality, and it affects the whole of the society. Neurodevelopmental consequences, when we talk about it, is hormonally driven and highly epigenetically regulated. There is an increased risk of the autism spectrum disorder. Friends, this developing autism spectrum disorder is the key which has really causes the whole scientific population in the globally think about it. And then we found plastics in the placenta, nanoplastic in the brain of the developing fetus. And it really propelled me to think and read about the EDCs. And then come in a mind, we all taking water from the syntax tank. Anyhow. So this ADHD, reduced attention span, poor impulse control, lower IQ. Then there's a thyroid hormone disruption and altered expression of the neurodevelopment genes. When we talk about the Today's fertility and the puberty timing, there is a early menarche, involutory cycle, development of the PCOs like phenotypes, and epigenetic dysregulation in the HPA ovary axis is a major factor. Then coming to the low birth weight and prematurity. These are the placental development, and the nutrient transport is impaired with the EDCs. There's a IUGR, there's a preterm labor, and the placental imprinted genes will go as a transgenerational. Then come to the metabolic programming and the obesity. Again, they alter the fat cell development, promote epidocyte differentiation via PPAR gamma pathways, and leading to the insulin sensitivity. This is the reason why suddenly there's so many PCO patients we are seeing, and why so much of the insulin sensitivity we are observing. It fits the 35 phenotype hypothesis that the fetal adaptation adult metabolic disease. Thyroid hormones are critical for the brain development and the metabolism. They block the iodine uptake, disrupt TSS, T4, T3 synthesis, and affecting the neurocognitive deficit, delayed language, and the motor skills. Now, when we talk about the sudden, so much endometriosis and uterine epigenetics, again, when we think of the EDC, it is one of the culprit because it's altered the uterine gene expression. There's an epigenetic modification of the HOXA10 ESR1W genes and result in the increased susceptibility to endometriosis, impaired implantation, and the infertility. Now coming to the cancer predisposition, they link to the breast cancer, prostate cancer, testicular cancer, and mechanism is silencing of the tumor suppressor gene in utero and long-term dysregulation of the hormonal control pathways. So what are the advances? There's a next generation sequencing enable genome-wide DNA methylation profile, placental tissue as a non-invasive biomarker sources, EDC-related methylation signatures, and emerging clinical utility in risk prediction and the stratification. There's so much development is happening. Actually, I was not aware at all, say 2-3 months back. I'm reading it for last 2-3 months in detail. When Neeru asked me what you want to speak, I said, I think this is the best topic which I can talk to each of us, because as a general obstetrician, we need to understand. The 3D organoid and the placenta on a chip model is coming. That is, organoids mimic in the vivo development. Placenta on chip platform stimulate maternal-fetal interface and bridge gap between the animal studies and the human relevance. Now we all talk about the AI. This AI model trained on the chemical structure database, toxigenomic profiles, epigenetic database, and predictive tools can identify high-risk compounds before clinical use and integrate exposure data with disease outcome. So tailoring prevention from the womb is very, very necessary. Personalized prenatal care model, environmental exposure history, genetic and epigenetic predisposition, targeted screening of the household and the occupational EDCs, empowered decision-making through environmental counseling, safer lifestyle product, and the substitution, which is necessary. Everybody is applying sunscreen right and left, and it is absorbing in the body. We have to tell them apply the zinc oxide based sunscreen, which is not absorbed from the skin. So nutritional epigenetic food as the first line of defense. Certain nutrients modulate epigenetic response to EDCs. We all know about the folate, B12, polyphenols, resveratrol. They are the epigenetic modulators, buffer or expedite. So designing hormone-safe future is necessary. EDC-free alternatives, green chemistry principle, and BPA-free environment. There's a future research in the multi-omics integration, fetal programming studies, in vitro approach, and call for the updated regulatory. So, in nutshell, avoid plastic container for food, takeaways. Choose fresh produce, Avoid cosmetics with the parabens, phthalates, triclosan. Minimize use of air freshener, scented candle, insect repellents. Prefer BPA free. But it is not enough. Promote label reading habits during the prenatal visit. That is the most important thing. Bio oil. Have you ever read the print? 3 aromatic oils, then there's a 20 small. If you go on the net, you see they're all banned in the European countries for last 10 years as a known teratogens. So as a clinician, you are the first point. Incorporate environmental history taking, educate patient during preconception counseling, lead initiative as a community talks, and advocate for the institutional changes. Summary from mechanism to the maternal action. Mechanism is the EDC interface with the hormone receptor. It has a long-term impact in the reproductive, neurodevelopmental, and OBGYN are uniquely placed to screen, counsel, and advocate, integrate all this education to the patient. Thank you so much. I will just say we are not only treating the present mother, but also shaping the biology of the future generation. Thank you so much.